So who is Dr. Mareena Reffai?
I'm an eye surgeon, and I have an organization which I set up in 1990. I was the founder, president, and now I'm the coordinator. And I'm also an alalima.
The challenges associated with the global pandemic is not something that we can summarize in few words.
Yeah.
However, I understand there are some unique challenges in Sri Lanka. Are you able to explain the current plight of the Muslim community in Sri Lanka as a result of COVID-19?
Yeah, it's not only the Muslim community, even the whole island, all the people have no guidance whatsoever, no planning by the health ministry, no practical effectiveness of things that they are talking about. So that's why you see, if you watch the news, people gathering everywhere without the mask and jostling each other and protesting. All these things are going on. And Muslims are no worse, though Muslim communities trying to bring them to practice the preventive measures and also educating them what to do in case there is problem. This is one side. Second side, of course, the economical problem. Everybody is going through a huge problem. No jobs, no income, no access to food, and so on. And government is not at all bothered. Third, of course, the cremation problem. The Muslims' bodies, whether they died of COVID or not, a PCR test is done on the dead bodies, and then when it is positive, they just decide to cremate it. These three are the biggest problems.
I'll start with the cremation issue.
Right.
What is the reasoning behind that cremation only policy that the government has introduced?
They have no policy. There's absolutely no policy whatsoever. And it is very open and very apparent. They have just uh, nominated a committee which have none of the virologists, none of the epidemiologists, none of the specialists in this particular manner. They won't even publicize the names of the people in the committee and some doctors, right? And they all get together and say, okay, this is bad. But the main thing they are coming out with is a person called Methika Vithanage, who is not at all a doctor or a virologist or an epidemiologist or in any sense related to this particular matter whatsoever. She's a hydrogeologist and she has no idea about virus even. Some other things that she has said are laughable. So she said if you bury them after about 5-10 years, they will burst open the land and come out like a volcano sort of thing. That's a verse that she used. And now she's saying, what do we know? It may stay in the bodies for ages, and then after 20-30 years it may come out. And the main thing that she's saying is, if you bury them, the virus will spread to the water level. Whatever explanation is given, she is not willing to listen. That obviously says a lot of things why she's doing. And other than her we have world-renowned virologists in our country. And they are openly and publicly saying this is utter nonsense. There's no such thing. But government is not willing to listen. So there is no policy, no reason. They're passing the buck. The government, when the president is asked, he says, I can't do anything. We had to ask the health department. The health department says, we had to ask the committee. So committee just says, no, we are worried about what can happen. That's it.
So are you saying, doctor, this is based on a hypothesis and there is no evidence for any of the claims that we see in the media?
Actually, there is no hypothesis even. Right? There's no proper explanation given whatsoever. We kept on repeatedly asking, uh, of course, you know, the Muslims community from all stratas tried to speak to the president and the health department and whoever could make any changes at all. And none of them have any idea at all. The only thing they say is, if we buried, it can go to the water level and can spread afterwards, knowing jolly well that virus cannot survive in water. It's just, I would say, thumbing the nose at the world, at science, at their own specialist, because this is what they want to do. That's it.
So I don't know whether you have the numbers with you with regard to this. Do you know how many deceased Muslims have been cremated so far in Sri Lanka?
Actually, the total number deaths within the period from March to now is 187 up to yesterday. Out of them, we don't know the exact number of Muslims, but tentatively it is something around 100, 110. So it's more than 50% that we know. What's happening is when a Muslim dies of any cause, even an accident, even a bedridden person who never went out and nobody came to visit them for years dies, they do a PCR test. And the PCR test often comes out as positive, often than not comes out as positive. And then they say this is PCR, positive means it's corona, and therefore we have to bury, and they are burying. There is no secret. I mean, nobody is hiding this fact, or they do not sort of find excuses or anything. Blatantly, they're saying, you know, all these people died of corona. That's it, or died with corona.
And
Yeah, we ask for the results. Often nobody is willing to give the results of the PCR test even, though they keep saying if you ask, you will be given. But it's not being given most of the time.
so, what level of conversation and appeals have the people raised with the relevant authorities?
Whatever that could be done had been done. Though most of those do not come out into the public, I am also a steering committee member of Muslim Council of Sri Lanka, and also into this decision-making committee with the mosques and so on, about how to guide people and so on. So generally we are aware of the things that are happening. Everybody who could make any impact or change had been spoken to, either by the religious leaders or intellectuals or influential people or effective business people or even the ministers and MPs and so on. Everybody had spoken. They are just passing the ball. They say, "Oh, tomorrow we are changing this, and we'll, think. Then we find a land, we will find this one." And the next day, so they say, "No, no. Even if you find the land, we are not going to do this." So it is just uh, totally, absolutely one-track mind. We are not going to listen. And anywhere, 194 countries in the world, they are all burying. And most of them are burying in their usual burial grounds. They are not even finding faraway places from the water levels or from living quarters or anything like that. So the only thing that could have uh, proven to them is these areas. Now it's 9 months. So there would be areas where they have buried all these 9 months, and then the water levels could be tested nearby and so on. We did think about it. I'm also a committee member of the uh, Ceylon Doctors Forum. So the doctors also had been thinking about this, but uh, we know even if it is proved somewhere else, they are not going to accept it. And anyway, such a thing, if proved to be actually published and accepted, will take at least 6 months. We did ponder that maybe even in 6 months we should do, because we don't know how long this is going to go on. There is no way. And the second option they said was, we'll put the bodies in cold storage and make a decision later on, and then they'll cremate it. That also fizzled out. They are just going ahead and cremating. There is no solution in the near future except after the election. They're waiting for the election, right? Once the election is over, they probably might give some excuse and then, hopefully turn back.
So, in your mind, is there any other reason why authorities are not heeding to appeals and solutions that the committee is coming up with?
They are openly saying why they are doing this is, actually somebody who attended the high level official meeting yesterday, I just spoke to him, and they're openly saying that Muslims did not vote for them. They came to power because of the hardcore Buddhists, and they have to keep them pleased in order to win the elections. And it doesn't matter, what the Muslims are going through is simply ignored. That is the reason. Everybody knows that. There is no hiding that fact.
So, what are the social economic impact do you observe from the whole COVID-19?
Terrible. Terrible to say the least. Suddenly they detect, some cases, and that whole area will be either locked down or declared curfew. And these people are not given any relief at all. They said that they are going to give 5,000 rupees per family, which also, when people went to collect, they checked the voting list and checked whether these people voted for them, and if they are voted only, they were given. And even they were not given really properly. Even the Sinhalese people are very upset about that. That plan had not been executed properly either. There are some areas in the beginning, the government organized the army to come and distribute dry rations and so on, which could be bought. But then people have lost all jobs, especially the daily wage earners or three-wheeler people or the small business people. Everything is closed, shops are closed, and the people are not allowed to go out, and people are scared to go out, and no income whatsoever. Even if you have money, there is no way that they can get whatever dry rations you want. Though there is a system which had on its own developed a delivery system online on call, they come. So that's a small consolation. But people who had been on the lower middle class and the poverty driven people, absolute chaos. Nothing to eat and no way to earn, and whom to tell. There is nobody to help them. Very sad.
So I understand, Dr. Marina, that you have other social initiatives
Yeah.
to help people, which was started way before COVID-19,
Long before.
to help people in need, and especially the vulnerable people in our communities, like the senior citizens. And I hear that you have a project, some sort of initiative that is taking place in somewhere in Ratmalana.
Yeah.
Can you please explain to us what is that and how are those people impacted because of COVID-19?
Actually, Muslimaath was set in 1990, and the purpose was twofold. One is to educate the women. Second is to uplift the downtrodden women, especially widows and orphans. So we have been helping them in whatever way we can, mainly not just financial, but in a holistic way, like make sure that they are empowered, they earn some money on their own. If possible, we get them married again, and we get the children to get educated. We have a school where they can come free of charge, an international English medium school where we don't charge if they can't afford to. And when they pass out, we try to find jobs for them and get them married, and so on. So it is a total plan to elevate their situation. And we have 6 institutes. One of them is what we have in Ratmalana, to house destitute women, elderly women more than 50 years old, who have nobody. Either children are not here, they are abroad and they don't look after them, or no children, no husband, no relatives who are willing to look after them, or people who are found in on road or in the hospitals left and gone. Anybody like this, these people we collect them, and then we have been running this for about now 5-6 years, and we keep them and feed them, clothe them, and educate them, make them enjoy life. I mean, it's a place where you spend your last days with maybe 20 years, 30 years, we don't know, and make sure that their life is pleasant, right? So, Alhamdulillah, we are running. This is just one of our projects. We have an orphanage where the orphans or the destitute children come and stay there. Not necessarily orphans, people who cannot look after their children for some reason. The mother had gone abroad and the father can't leave the young girl and go to work, or vice versa. The father is not there, mother can't leave the child and go to work, or abused children handed over by the courts, and so on. Then we have another project for destitute people as a transit home, which also at the same time educate the young girls on life skills to have a good married life, and so on. And we have international school, as I told you. We have a school for the disabled children that's also run free, and they come and study and go. These are the ones.
So we spoke about two topics today. We spoke about the cremation issue that is facing the community in Sri Lanka, and we also spoke about, as a result of that, and the additional pressure that is putting on the support structures that you have initiated through Al Muslimaath. What is your call for action if you were to ask the expats of Sri Lankans who are living in other countries like Australia, UK, and US?
At the moment, I would say provide them with financial assistance so that they can eat. That is the primary. We have given millions, really, alhamdulillah. People have helped us, but that's a drop in the ocean. And how long can they survive on a 2,000, 3,000, 5,000 when the family has 5, 7, 9 people? So this is one problem. The other side, I would say, on a creative side, we should have some sort of education of our Muslims. I'm not talking about the secular education or religious education. I'm talking about corona-related education to prevent these so-called corona deaths. We actually don't know whether all these PCRs are positive. We also don't know whether they are actually negative and made to be positive. So we have to assume that they are positive and look at the reasons why Muslims are having so many corona people. And what we could do is to really educate them and make sure that they follow all the rules and regulations so that the infection rate will go down. Those are the two things I think at the moment. in the
So
long
thanks for that, and thanks for making time. I know it's a bit late in the day for you, and it's early hours here in Sydney. It's 1:30 a.m. On Monday.